Hello. Settle in comfortably, wrap yourself up warmly, and let the gentle whisper of stories carry you into a deep, peaceful sleep. In the late 1960s, a pervasive aroma, often sweet but increasingly acrid with the fear of prosecution, floated through America's counterculture havens. This wasn't the open, celebrated scent of a blossoming movement, but the furtive wisp of a substance pushed deep into the shadows: cannabis. For decades, America had been fed a steady diet of anti-marijuana propaganda, exemplified by films like Reefer Madness, 1936, which depicted users descending into madness and depravity. This narrative, however exaggerated, formed the basis of stringent prohibition. By 1970, the legal landscape was a minefield. The Marijuana Tax Act of 1937, effectively prohibiting cannabis, was reinforced by state laws that often carried harsh penalties. Possession of even small amounts could lead to years in prison. Yet, despite the escalating legal risks, cannabis use was on the rise, particularly among young people and artists. Surveys from the period, though challenging to conduct accurately given the illicit nature of the substance, indicated a significant increase in experimentation. For instance, a 1970 study by the National Commission on Marijuana and Drug Abuse estimated that over 20 million Americans had tried cannabis, a stark increase from earlier decades. The contradiction was immense. A widely consumed plant, perceived by many users as benign, was legally equated with dangerous narcotics. This disparity created an undercurrent of injustice, particularly for those facing severe sentences for what they considered a minor offense. Imagine standing in the hushed, anxious waiting room of a courthouse, a friend or loved one facing years behind bars for a plant found in their pocket. This tension, the silent suffering under the weight of an unjust law, became the fertile ground from which a new kind of activism would emerge, an activism not born of violent protest, but of reasoned argument and legal challenge. This acrid whisper of secrecy, the constant fear of discovery and punishment, was the quiet catalyst for a nascent movement that would eventually challenge the very foundations of American drug policy. The year 1970 marked a pivotal moment in America's war on drugs, solidifying the stifling grip of prohibition with the passage of the Controlled Substances Act, CSA. This sweeping legislation categorized drugs into 5 schedules based on their perceived potential for abuse and accepted medical use. Marijuana, despite mounting evidence to the contrary, was classified alongside heroin and LSD as a Schedule I substance, a drug with no currently accepted medical use and a high potential for abuse. This Schedule I designation was not a scientific consensus, but largely a political maneuver, reflecting the prevailing moral panic surrounding cannabis. Medical experts, including Dr. Todd Mercuria, an early advocate for medical cannabis, argued vehemently against this classification, citing historical uses and preliminary research hinting at therapeutic potential. However, their voices were largely drowned out by powerful political figures anxious to project a tough-on-crime image. The Nixon administration, in particular, utilized drug enforcement as a tool, with advisor John Ehrlichman later admitting that the war on drugs was, in part, designed to disrupt anti-war leftists and black communities. The CSA centralized federal drug control, replacing a patchwork of laws with a unified framework. it effectively criminalized all aspects of cannabis: cultivation, possession, distribution, and use. The penalties were severe. Simple possession charges could lead to significant jail time and hefty fines, especially for repeat offenders. This legislation disproportionately impacted minority communities, where drug arrests surged, filling prisons and tearing apart families. Data from the era reveals a dramatic increase in marijuana-related arrests post-CSA, demonstrating the law's immediate and far-reaching consequences. This ironclad legal framework created an environment where millions of Americans, from casual users to those exploring its nascent medical applications, lived under the constant threat of state-sanctioned punishment. The stifling grip of prohibition wasn't merely a legal concept, it was a daily reality for countless individuals, manifesting in raids, arrests, and incarcerations. It deepened the acrid whisper of secrecy, forcing cannabis culture further underground. Yet an undercurrent of dissent was beginning to surface, fueled by the very injustices being perpetrated. The stage was set for organized resistance as the federal government's uncompromising stance left little room for legal gray areas, forcing the issue into clear black and white. Against the backdrop of the Controlled Substances Act's imposing restrictions, a young public interest lawyer named Keith Straub found himself increasingly troubled by the discrepancy between federal marijuana policy and the reality of its widespread yet illicit use. Straub, after working at Ralph Nader's Center for Auto Safety, observed firsthand the power of organized advocacy and the potential for a small, dedicated group to challenge established norms. The stifling grip of prohibition, as detailed previously, had created a fertile ground for dissent, and Straub saw an opportunity to channel this frustration into constructive action. It was in 1970 that Straub, catalyzed by this vision, established the National Organization for the Reform of Marijuana Laws, or NORML, in Washington, D.C. At its inception, NORML was a shoestring operation, fueled by conviction and a small grant from the Playboy Foundation, an organization known for supporting civil liberties and challenging social taboos. This initial funding, reportedly $5,000, was enough to secure a modest office and begin the monumental task of changing public perception and federal law. Straub's strategy was clear. Rather than resorting to the confrontational tactics often seen in the counterculture, NORML would operate within the established political system. They aimed to function as a professional lobbying organization, presenting rational arguments, collaborating with sympathetic lawmakers, and challenging the scientific validity of marijuana prohibition. This was a significant departure from previous, less organized efforts to promote cannabis legalization, which often relied on protest and cultural defiance. NORML sought to be credible, respectable, and effective, bringing the discussion out of the smoke-filled basements and into the halls of power. Their initial focus was on decriminalization, reducing penalties for possession of small amounts from felonies to minor infractions, similar to a traffic ticket. This pragmatic approach aimed to alleviate the immediate suffering caused by mass arrests and incarcerations, laying the groundwork for broader legalization efforts in the future. NORML, therefore, wasn't just a voice for change. It was a strategically planted seed of rebellion, nurtured in the sunshine of public advocacy poised to grow and challenge the deep-seated prejudices surrounding cannabis in America. Its professional approach marked a turning point, ushering in an era of organized, sustained activism for marijuana reform. With NORML established, the fight against marijuana prohibition moved definitively onto the legal battlefield. But the human cost of the existing laws continued to mount. Every year, hundreds of thousands of Americans faced arrest for marijuana-related offenses, predominantly simple possession. These arrests, often for petty amounts, were not benign. They carried life-altering consequences: lost jobs, denied educational opportunities, professional licenses revoked, strained family relationships, and the indelible stain of a criminal record. The data from this era paints a sobering picture. In 1970, the year NORML was founded, there were approximately 188,000 marijuana arrests nationwide. By 1973, this number had skyrocketed to over 420,000. These statistics are not mere figures. Each represents a person whose life was fundamentally altered by the legal system for a substance that NORML argued was less harmful than alcohol. Imagine the young college student caught with a small bag of cannabis, now facing expulsion and a future clouded by a criminal conviction. Picture the father, losing his livelihood due to a minor charge, struggling to provide for his family. These were the daily realities under the Controlled Substances Act, the human faces behind the abstract legal battles. NORML, under Keith Stroop's leadership, recognized that documenting and publicizing these injustices was crucial. They collected case studies, highlighting instances of disproportionate sentencing and the destructive impact of prohibition on individual lives and communities. They meticulously tracked arrest rates and incarceration numbers, arming their arguments with irrefutable evidence of the societal burden imposed by marijuana laws. This human-centric approach provided the emotional weight needed to complement their legal and scientific arguments. Expert witness testimony from sociologists and criminologists began to surface, detailing how the enforcement of marijuana laws disproportionately affected minority communities and low-income individuals, perpetuating cycles of poverty and systemic inequality. The legal battlefield wasn't just in the courts or legislative chambers, it was in the homes and lives of everyday Americans. NORML's strategic focus on the human cost served as a powerful indictment of prohibition, pushing for a re-evaluation of policies that inflicted such widespread and often unjust suffering. This emphasis on individual stories was crucial in building the foundational empathy required for any successful reform movement. Beyond the abstract legal arguments and the stark human costs of criminalization, a more poignant plea began to emerge: the cry for medical comfort. While NORML initially focused on broad decriminalization, the suffering of individuals with debilitating illnesses who found relief in cannabis presented an undeniably powerful facet of their advocacy. The Schedule I classification of marijuana, asserting no currently accepted medical use, stood in direct contradiction to anecdotal evidence and a growing whisper among patients and some medical professionals. One of the earliest and most compelling cases arose in the 1970s with Robert Randall. Diagnosed with severe glaucoma, Randall was losing his sight. Traditional medications failed to stem the progression of the disease. Desperate, he discovered that smoking marijuana significantly reduced his intraocular pressure, providing him with a degree of vision and comfort he couldn't achieve otherwise. In 1976, Randall was arrested for cultivating cannabis. His groundbreaking legal defense, arguing medical necessity, became a landmark case. The federal government conceded, agreeing to supply Randall with medical cannabis from a special farm at the University of Mississippi via the Investigational New Drug (IND) program. This marked the creation of the Compassionate Investigational New Drug program. Randall's victory, though singular, opened a crucial avenue for NORML. It provided undeniable proof that, for some, cannabis was not merely a recreational drug, but a vital medicine. NORML actively publicized Randall's case and others like it, amplifying the voices of patients who found solace in the plant. They presented expert testimony from doctors and scientists, such as Dr. Todd McCurrier, who had catalogued hundreds of historical and contemporary medical uses for cannabis, challenging the federal government's restrictive stance. The medical plea tapped into a deep well of public empathy, transcending political divides. It highlighted the absurdity and cruelty of denying a therapeutic option to suffering patients while simultaneously labeling it a dangerous substance with no medical value. This compassionate front became a powerful tool in NORML's arsenal, shifting the debate from mere personal freedom to one of human welfare and the right to access effective treatment. The cases of individuals like Robert Randall provided irrefutable human proof, transforming abstract legal battles into tangible stories of suffering and relief, a cry for comfort that resonated far beyond the confines of clinical trials and courtrooms. The fight for marijuana legalization was never purely a legal or medical battle. It was inextricably woven into a larger cultural confrontation. Initially, cannabis use was firmly associated with the counterculture movement of the 1960s, a symbol of rebellion against societal norms, war, and the conservative establishment. This association, while galvanizing a generation, also alienated a significant portion of mainstream America, allowing opponents of reform to easily dismiss marijuana advocates as radical outsiders. However, as NORML began its work in the early 1970s, a subtle but significant cultural shift was already underway. Cannabis use, while still illicit, started to permeate beyond the immediate confines of the hippie movement. Journalists, writers, musicians, and even some professionals began to experiment, quietly finding personal use for the plant. Studies from the early to mid-1970s, such as those conducted by the National Commission on Marijuana and Drug Abuse, indicated a rising prevalence of cannabis use across various demographics, albeit still predominantly among younger adults. This meant the marijuana user was becoming a less singular, more diverse figure. NORML, astute in its understanding of public perception, sought to destigmatize cannabis by consciously distancing their advocacy from the more radical elements of the counterculture. Straub and his colleagues understood that for long-term legal reform to occur, marijuana needed to shed its image as a subversive drug exclusively for fringe elements. Their strategy involved presenting a sober, professional, and data-driven argument intended to appeal to lawmakers, policymakers, and the broader, more conservative public. This was a deliberate effort to bring the conversation from the fringes into the mainstream. Instead of sit-ins and psychedelic protests, NORML engaged in lobbying, legal challenges, and public education campaigns grounded in pragmatism and evidence. By highlighting the human cost of prohibition and the medical benefits, as seen with cases like Robert Randall, they began to chip away at decades of negative propaganda. The goal was to transform perception from a dangerous illicit drug of the counterculture to a substance warranting thoughtful regulation, much like alcohol or tobacco. This careful navigation of cultural perception was crucial, signaling a maturation of the legalization movement from a rebellious outcry to a sustained mainstream political endeavor. As NORM steadily built its case, the late 1970s brought an unexpected but crucial shift in the political landscape, signaling that the winds of change were beginning to blow. The persistent advocacy, grounded in factual presentations and human stories, started to chip away at the monolithic opposition to marijuana reform. The sheer economic and social cost of enforcing prohibition was becoming increasingly apparent to policymakers. A landmark moment arrived with President Jimmy Carter's administration. In 1977, President Carter addressed Congress, stating, "Penalties against possession of a drug should not be more damaging to an individual than the use of the drug itself." This declaration, made by a sitting U.S. president, represented an unprecedented presidential acknowledgement that current marijuana laws were disproportionate and harmful. It sent ripples through the political establishment, legitimizing discussions around decriminalization in a way previous administrations had emphatically avoided. This shift was not solely due to NORML's efforts, but their relentless lobbying played a significant role in creating the environment for such statements. They had effectively influenced opinion makers and presented compelling evidence, preparing the ground for political leaders to consider reform. Following Carter's statement, several states began to re-evaluate their own marijuana laws. Between 1973 and 1978, 11 states, Oregon, Alaska, California, Colorado, Maine, Minnesota, Mississippi, New York, North Carolina, Ohio, and Virginia, decriminalized possession of small amounts of cannabis. Oregon was at the forefront, having decriminalized marijuana possession in 1973, reducing possession of an ounce or less to a civil violation, punishable by a small fine. This model demonstrated that easing penalties did not lead to the public health and safety crises that prohibitionists had long predicted. Crime rates did not soar, nor did youth drug use dramatically increase. These pioneering states became real-world laboratories, providing concrete evidence that a more lenient approach could be successful. This tangible outcome, paired with the growing medical evidence and the cultural recontextualization, proved that the smell of change was more than just a fleeting scent. It was a powerful indicator of shifting public and political opinion, ushering in the first wave of meaningful reform. While statistics and political pronouncements painted a broad strokes picture of the legalization movement, it was the raw, individual narratives that truly underscored the moral imperative for change. NORML recognized early on that connecting the abstract concept of marijuana law reform to the struggles and triumphs of real people was paramount. These were not just legislative battles, they were deeply personal fights for dignity and freedom. Consider the ongoing plight of medical patients beyond Robert Randall. As more states adopted decriminalization, the stories of individuals suffering from conditions like cancer, AIDS, and multiple sclerosis, who found genuine relief in cannabis but risked arrest to access it, became increasingly vocal. These were not recreational users, but gravely ill individuals forced into the shadows by an unresponsive legal system. Organizations like the Cannabis Buyers Club, founded in San Francisco in 1992 by Dennis Perron, emerged out of necessity, providing safe access for patients despite federal prohibition. These clubs, operating in legal gray areas, became sanctuaries, showcasing the profound human need that current laws ignored. NORML amplified these voices, using their platforms to share testimonials from patients and their families. These weren't clinical reports, but impassioned pleas from individuals describing reduced pain, regained appetite, and an improved quality of life directly attributable to cannabis. They spoke of the fear of arrest, the difficulty of finding reliable, safe sources, and the moral injury of being treated as criminals while seeking comfort. Moreover, the stories of those disproportionately affected by prohibition, young people, and particularly minority communities, became critical. Attorneys working with NORML documented cases where individuals faced years in prison for minor possession charges, highlighting the racial disparities in arrests and sentencing. These narratives illustrated how drug laws were not applied uniformly, often devastating already marginalized communities. The personal stories transformed universal rights from an abstract legal concept into a tangible demand: the right to bodily autonomy, the right to equal justice, and the right to medical self-determination. By weaving together these diverse, deeply human experiences, NORML forged a powerful emotional connection, reinforcing that the fight for marijuana reform was ultimately a fight for fundamental human dignity. The push for cannabis legalization, initially rooted in civil liberties and medical compassion, began to acquire another powerful dimension: economic potential. As some states cautiously moved towards decriminalization and later medical cannabis, a compelling financial argument started to emerge that significantly reshaped the debate. The idea that a regulated cannabis industry could generate substantial tax revenue, create jobs, and stimulate local economies offered a compelling new narrative beyond merely ending prohibition's human costs. Early proponents of legalization highlighted the vast sums of money being spent on enforcing prohibition, diverting law enforcement resources and taxpayer dollars to a seemingly unwinnable war. Experts from think tanks like the Rand Corporation and the Cato Institute began publishing economic models demonstrating the potential for significant tax revenue from regulated cannabis sales. These studies projected billions of dollars annually for state and federal coffers, funds that could then be allocated to education, infrastructure, or public services. This was particularly attractive to states facing budget shortfalls. Moreover, the prospect of a legitimate cannabis industry promised job creation across diverse sectors: agriculture, retail, processing, security, and ancillary services. It presented an opportunity to shift substantial portions of the illicit, untaxed black market into a regulated, taxable white market. For example, when California passed Proposition 215 in 1996, establishing the first medical cannabis program, it inadvertently created the blueprint for a new economic sector. Although initially unregulated, the sheer growth of dispensaries and supply chains hinted at the immense economic activity waiting to be formalized. However, this economic bloom was not without its thorny path. The transition from illicit to legitimate brought complex challenges, establishing regulatory frameworks, ensuring product safety, addressing social equity concerns, and navigating the persistent federal prohibition which hindered banking and interstate commerce. Despite these hurdles, the sheer financial scale of the potential market offered a potent incentive, captivating the attention of not just activists and patients, but also entrepreneurs and policymakers. The economic argument provided a hard, quantifiable rationale for reform, broadening the coalition of supporters beyond traditional advocacy groups and injecting a powerful new momentum into the legalization movement. The promise of prosperity became a significant driver, illustrating how NORML's initial seed of rebellion had blossomed into an issue with profound economic implications for the nation. Today, the landscape of cannabis in America is vastly different from the acrid whisper of secrecy that birthed NORML. Decades of relentless advocacy, rooted in facts, human narratives, and economic realities, have transformed the conversation from total prohibition to widespread acceptance of medical use, and, in many states, adult recreational legalization. Yet, despite this monumental progress, a lingering haze of federal prohibition persists, casting a shadow of uncertainty over the future. As of early 2024, 38 states and the District of Columbia have legalized medical cannabis, and 24 states plus DC have moved to legalize adult recreational use. These legislative victories, often achieved through grassroots ballot initiatives propelled by organizations like NORML and its allies, reflect a dramatic shift in public opinion. National polls consistently show a strong majority of Americans supporting legalization, with Gallup's 2023 survey indicating 70% in favor. This widespread acceptance is a testament to the movement's success in educating the public and dismantling decades of misinformation. However, operating beneath the weight of federal schedule, one classification creates significant challenges. Cannabis businesses in legal states are unable to access traditional banking services, face exorbitant tax burdens due to IRS code 280E, and cannot transport products across state lines, severely hindering economic growth and efficiency. This federal-state dichotomy also perpetuates inequities, as individuals in states where cannabis remains illegal continue to face arrests and convictions, often disproportionately affecting minority communities. The human cost, while reduced in some areas, has not been entirely eradicated. The future's promise lies in comprehensive federal reform. Efforts to deschedule or reschedule cannabis at the federal level, such as the MORE Act or Safer Banking Act, continue to gain traction in Congress, though progress is slow. The complete removal of cannabis from the Controlled Substances Act would unlock its full economic potential, foster research into its medical applications without undue restriction, and most importantly, rectify the historical injustices of the war on drugs. NORML born from the urgent need for change, continues to champion these efforts, proving that even as the landscape evolves, the fight for full, equitable legalization remains their unwavering mission. The path is clearer, but the journey to completely dissipate that lingering haze is far from over.